Hello, good afternoon. Y muy buenas tardes. I'm Joanne Prado with the pesticide program at the Washington State Department of Health, and I'm very pleased to be here with you, albeit virtually. This session is Promotores and Pesticide Drift Protocols, and trying to forward a slide here, and I was told how to do that. Great. Whoops. On behalf of myself and my co-presenters from Quincy Community Health Center, Mary Jo, Ybarra-Vega, and Priscilla Tovar, I want to thank the conference organizers and add a shout out of recognition to Sylvia Gomez at the National Center for Farmworker Health and Kellen Dempsey at Northwest Regional Primary Care Association, who've been so great about helping us get what we need to do, what we needed to do to make this session happen, and also the folks that are helping us just go virtually right now. Our session is divided into three parts, three specific sections, and just a brief background. I've done many presentations about pesticide-related illness, and for the most part, they've been pretty forgettable. But the cases we investigate at the pesticide program with the State Health Department and the people I work with who've investigated them, that's Tito Rodriguez, Jennifer Sievert, and Paul Marchant. Some of these cases are just so striking and may be considered a testament to the failures of the systems of public health and worker protections that exist to keep people safe at work and at home. And let's be clear, it is never okay for pesticides to drift off their intended crop or the field, the target where they're intended, and onto a person. It's illegal and it's dangerous. So in the first section, I'll be talking about the laws and how to report drift if you should encounter it. A little bit about the framework supporting the agency roles that investigate situations that are reported to them. In the second part, we have Mary Jo and Priscilla talking about a situation, actually presenting the case study that they were involved in. It's going to be much more interesting and hopefully memorable to folks. And they're going to be covering what they saw, heard, felt, and what they did when they were exposed to pesticide drift during the course of their work. I think it's much more powerful here to hear from them. And I thank again the whole Migrant Health Forum for enabling this, and I think it would be great if we had a forum that enabled the voices of the 12 H-2A visa holders that were also present at the time. But the third piece here is an audience participation piece, and we're going to try and make sure we leave enough time for that. So moving on. I'll pass it over to my co-presenter, Mary Jo Ybarra-Vega.
Okay, so maybe Zach can help us. Hi, everyone. This is Mary Jo Ybarra-Vega. And in true Promotora fashion, we're going to ask Zach if he will have us all come back on so we can see each other. And then we're going to do a dinámica that's called Lluvia. And I need you to just kind of do what I do and see what happens. So Zach, if you can unmute us all and bring us all up so we can see each other. Are we ready? Okay, can we start? All right, let's do this. Ready? Here we go. Hope we're unmuted. And we're going to snap. And we're going to tap. Snap. Okay. Okay, you guys, thanks, Zach. So the reason, and I'm not sure if I heard everyone, I was hoping that we could kind of hear a little rainstorm and just kind of do that together as a group. I was hoping to be able to hear you guys. I heard myself, and I think I heard my workmate Priscilla next door. But we just kind of wanted to start off with the dinámica that's very promotora-like. We do icebreakers, but they're intentional, and they help us get ready for what we're going to be talking about. If I were with you, I would ask you, why did you think that we would do something like this? Why would we do a dinámica like lluvia, as we're going to start talking about pesticide drift? And I'll start with saying that after you would say a couple comments to me, I would say that ultimately we, I have very fond memories of rain coming down on my face, or, just very light rain coming on me, and just feeling and smelling that smell that feels and smells so wonderful. Unfortunately, after the pesticide drift, I now have sometimes different thoughts when I feel something coming down on my face, because we were sprayed on, unfortunately. And so we're going to talk about our story later. I'm going to go ahead and hand it back over to my colleague, Joanne, and she'll begin the part of the.
All right. And can I get a signal? I'm unmuted and people see my screen now. Back again. Yay. Okay. So reporting matters. Pesticides are toxic and people are exposed. There are over 1 billion pounds of pesticides used each year in the United States, and most of those are used in agriculture. Agriculture is a super important industry, and for many reasons, jobs, and it does boost the state and community economies for just a couple reasons. But there's just a lot of it going into fields, homes, and the environment. More than 20,000 pesticide products are marketed for both agricultural and residential use. So that's the combined. It is difficult to ensure the safe and appropriate use of pesticides. And so we know this because programs like ours investigate, and at the state departments of health, they investigate, and they do find some problems with safe and appropriate use. The pre-market testing of pesticides also is a good thing, but it's not complete. We know this. We know that it's not foolproof, and that in spite of the best efforts of the regulatory framework that should protect dangerous products from coming or remaining on the market, some do fall through the cracks. There's one example of that happening written up, and I placed it in your folders for this session. It's an article produced from the MMWR, that's the CDC publication of illness and mortality. And this is about a situation of exposure to 20 workers in Douglas County, Washington, and they were exposed by drift to a pesticide that was newly marketed and sold and available for use. In that one, both the Departments of Health and Departments of Agriculture investigated. So our agencies do often work together to fully investigate pesticide drift reports when that's appropriate. We know that the people are exposed in addition to the national studies that are done, like the National Nutrition and Health Survey and California's programs of research that they collectively call the Chamacos studies. There's also a new paper by the North Carolina researchers, Accury and all, that really look at variations in exposures at different types of levels in different communities, farm workers and others in North Carolina. And so that's recently published. The poison control centers receive about 90,000 calls each year. About 40,000 of them involve children under 5, calls related to pesticide exposures and concerns. The U.S. Environmental Protection Agency estimates 10 to 20,000 physician-diagnosed pesticide poisonings occur among U.S. agricultural workers each year. And we know that that's an undercount. There's just no way that every single pesticide exposure that results in symptoms of ill health or injury that experienced by farm workers are reported and come to the attention of surveillance systems and are documented, identified, and reported on. And I also have an article about that in your packet. So the federal response to these problems of toxicity and exposure, the granddaddy of them all is called FIFRA. That's the Federal Insecticide, Fungicide, Rodenticide Act. It's a mouthful. But in 1947, that was passed. And then in 1972, some additions were made to it. The 1972 amendment gave the Environmental Protection Fee a little more teeth. And under that, a program for controlling the sale, distribution, and application of pesticides through registration and other processes was established. And although certain use, experimental permits, and others were enabled, basically the EPA got a lot of ability to regulate pesticides. The states were authorized to regulate the sale or use of any pesticide within the state as long as it didn't undercut the federal regulations or go less than the federal regulations. That large area of law is generally something that the EPA designates to the departments of agriculture at the state level to be the boots on the ground in regarding enforcement. I should say that, in states like Washington State and other, everywhere in the country where you have Native sovereignty, those Native American tribes have their own ability and enforcement capacity, and as a separate nation status. The Occupational Safety and Health Administration Act in 1970, that enabled what we know of today as OSHA. And within OSHA, the whole reason for that was protecting workers at the work site. And in 1983, that was strengthened with the hazard communication standards. So, that any worker, including farm workers, are supposed to be able to get information about exposures or dangerous hazards that they may have on the work site. So the third key piece of legislation, the federal statute, is the Agriculture Worker Protection Standard, and is very well covered by Amy Lieberman and Iris Figueroa in this morning's session on farm workers and pesticide. The Ag Worker Protection Standards intend to protect workers specifically from pesticide exposure and enable them to get information they need about pesticides. And so in a way, it's kind of really focusing in what OSHA standards, had intended to do also, but focusing in on the agricultural workers. The 2015 amendments that were made to that actually went into effect. They had to wait until 2018 to become in effect or to be put in effect. And they're still being argued about in the courts. But importantly, among other things that they did, they specifically put in a statute to protect workers from retaliation that they might receive as a consequence of reporting a problem at the work site, including pesticides. Now, in a lot of states, like Washington State, we have state laws that kind of really spell out what the authorities are. In this instance, Washington State law in 1989 named Department of Health as responsible for following up on reports, developing a system to follow up and really surveil or follow up on illness reports that was coming in or being, just heard of from the community, from public, and to develop a system to do that at the state health department, following the enabling legislation for the Department of Health pesticide illness surveillance program. The Notifiable Conditions Acts, which are already in existence, was was bulked up to include pesticides illness, suspected pesticide-related illness as a reported condition. So physicians and clinics are required under our law to report. It's not the same in every state, but it is in many states. We established a memorandum of understanding with the Washington State Department of Agriculture, just agency to agency early on, and then with all three agencies that have involvement in following up and worker and community protections around pesticide use in 2010. We have that now with the three agencies, and in part that was because it was hard for agriculturalists, for growers, to have three separate agencies come onto their properties at three separate times investigating the same incident. So we worked together with L&I, our Department of Labor and Industries, our OSHA designee for the state, and the Washington Department of Agriculture. So how to report? This is just really what I think I need to talk about, and that's there are the three state agencies in most states, in Washington, and I think other states that I've looked at. Their Department of Agriculture, boots on the ground for really the regulatory arm and the protection arm, that Environmental Protection Agency, those statutes under FRIFRA and other statutes. The state OSHA designee, for us it's Labor and Industries, Cal OSHA in California, other states have their designee. And then the State Department of Health does not have in our state regulatory authority for this, but we do have state statutes that does require us to get involved and investigate and report on our findings. So for most, it's mostly important to understand that really none of these agencies are rapid responders. You know, I think that certainly at the Department of Health, we are not a good call for a real, like an urgent or an emerging situation. We would encourage people, first of all, in emergent situations to call 911 if that's appropriate, if your health is at risk and you need emergency vehicles on site. If a drift is happening quickly and you need, action to stop it, the departments of agriculture, or maybe your states, other states have it differently, but for our state in Washington, if there's a problem, you view a drift, you see it, please, don't approach it, but, let's get the Department of Agriculture or local law enforcement out to investigate. The Poison Control Center for Washington in our region has a very unique, we have established a unique reporting relationship because we learned early on in our work that physicians really, we weren't going to get reports directly from them. And so through calling or contacting the Poison Control Center, and I think all these 1222 numbers are similar around the country, for us, that meets the healthcare provider notifiable conditions expectations. The other piece of that too is that for those clinicians or clinics that may be seeing patients that they suspect, you don't even have to have a firm diagnosis, but if you're thinking it might be and you can't eliminate it from the diagnosis, for those clinics that suspect pesticide-related illness in one of the patients they see, when they complete the report of accident that under the workers' compensation claim process, we automatically get that. We have a working relationship with our workers' compensation claim unit at the Department of Labor and Industries to get weekly uploads of their, what they call them ROAs, their reports of accident that involve workers that have been exposed and may be ill because of pesticide exposures. So actually, that's the way that we obtained information about a report about the illness that's going to be described in a minute by my co-presenters. And I think I covered emergency situations. So when you report, it's important to, there are different agencies, a bunch of people involved, but mainly it's the state departments of agriculture, the OSHA designee, and the state departments of health. And nobody expects you to know their numbers and to call everyone. For our state, we've worked it out that if you can contact the Poison Center, that the Department of Health will get that and will share that information with our sister agencies as is appropriate, if that's appropriate. And if you see something that doesn't involve a human illness, you can report in Spanish or leave a message in Spanish or English on the Washington Department of Agriculture report line at that 2020 line. So that's just for Washington State. Other states may have similar types of expedited reporting directly to their departments of agriculture. So why do this? Why is it important? It's all about prevention. You know, we have these systems and relationships in place so that the agencies can follow up and properly investigate problems as they occur. When they include human health illness, health state departments, at least 13 of them that participate in pesticide illness investigation, pesticide illness monitoring and prevention programs. The purpose is prevention, and only through, you know, reporting do we learn about these cases and able to share, you know, report on findings, share with other states and the Environmental Protection Agency to try to make the changes necessary to prevent them. So this is my final slide, and I just wanted to mention that the sensor, not only do we work with other, you know, with the regulatory agencies, Department of Ag and Department of Labor and Industries, to investigate as that's appropriate and share information, you know, broadly when we have findings. That's de-identified information. We never share personal identifiers. We work with 12 other states under a system that the Center for Disease Control it's the National Institutes for Occupational Safety and Health, NIOSH. They have a program in place called Sensor. And we share information about pesticides and about the scenarios that we see. And, you know, constantly farm workers are the population for any of these agricultural-based states, the population most of concern. For Washington State, it's certainly farm workers and also rural residents, not farm workers. So we have certain counties that we know time and time again appear more often in our data, and we do know that our data is an undercount. So with that, I want to turn it back over to Mary Jo.
Okay, you guys, sorry, low tech Aztec here trying to figure this out. Give me a second. Would you guys let me know when you guys can see the PowerPoint, please?
So far, we're just seeing a black screen, Mary.
Okay, so maybe Zach needs to come on and help me.
Yeah, hey Mary Jo, just click the share screen button on the bottom of the screen on the Zoom.
Okay.
Make sure you can see that. Click that button, and then you'll click the screen 1, and then you should be good to go.
I'm sorry, what am I supposed to?
Click the share screen button.
I did that.
It'll stop other screen sharing, and you press yes.
Okay.
And then you should see screen 1.
Okay.
And then click share.
Not seeing that.
Okay.
I'm sorry, you guys.
What are you seeing when you click share screen, Mary Jo?
Well, I see lots of boxes, white boxes, and then I click on my presentation.
You got it. Now it's sharing. You're good to go.
Super. Thanks, you guys. Okay, again, thank you. And again, I have other gifts. This isn't one of them, so we'll start from there. How's that? So I'm gonna jump forward a little bit and just really quickly go over some of the learning objectives that we wanted for this presentation. And again, we'd hopefully want to learn that we would describe positive outcomes or actions involving this team of promotoras and the process that we used when we were exposed, and basically we want to know what we did right. So, right, that's one of the things we'd hopefully be able to talk about. And also list some actions that migrant and community health centers and staff may consider in reducing incidences of pesticide drift, with their either workers or themselves, including like our staff. And then finally, the last objective that we're hoping that you'll walk away with is to find out what some of the roles of the state Department of Agriculture, Department of Health, and Labor and Industries play in preventing pesticide and preventing pesticide illnesses. So we'll start there. And I also, my other co-presenter is my coworker, Priscilla, and she'll be jumping on here in a little bit. So we're going to start sharing our story. There's Priscilla, closest to you in the picture. And then immediately in the middle is our coworker, Lupe, who is not able to present with us. But we just wanted to make sure that we included her because she was there with us and also was a big part of the story. So, and I'll start off by just kind of telling you how and where it was, and then Priscilla will go into actually what happened. So this is an actual aerial picture of the map where the incident happened on May 12th. And, you'll actually see some pictures that we've added in here during the same day, during the time and the place where we actually were sprayed on. And I think at this point, I'm going to have my coworker Priscilla begin to share the story of what happened. So she's going to read directly from her report that she shared with the Department of Agriculture. Go ahead, Pris.
Thank you, Mary Jo. Hi, everyone. Priscilla Tovar. So I'm actually going to just be reading my statement that I wrote for the Department of Agriculture. So it says, to whom it may concern, on May 12, 2020, my coworkers Lupita, Mary Jo, and I had a scheduled outreach event to provide COVID education with Above the Dirt's H2A workers at their housing site. We arrived at the housing site at approximately around 1 p.m. All three of us got out of the company vehicle at the same time. Mary Jo approached the workers sitting in front of their home, cabin 1. Lupe and I opened the back of the vehicle to unload when all of a sudden we heard Mary Jo say something along the lines, "Oh no, he is not spraying, is he?" When Mary Jo started walking toward the front, she saw a sprayer applicator spraying in the neighboring orchard, McDougal. When I turned, I noticed he had stopped and I heard the machinery being turned off. By then, the workers had started walking towards the back where we were. I was still standing at the vehicle's end when another sprayer came within a minute or two. He was coming from the left. One of the workers was standing next to me, helping unload boxes and a small table. When we heard and saw the mist coming through the trees, it was an overcast day, so the wind picked up and the mist carried over. Mary Jo quickly told me to record, but I wasn't quick enough to capture the whole thing. My coworker Mary Jo heard the mist on my jean jacket. So I don't know if you guys can notice, quick side note, the background for the presentation, it reminded her of my jean jacket. So Mary Jo heard the mist on my jean jacket the second time. Mary Jo contacted our clinic director, Lynn Bales, and Above the Dirt's office assistant, Mireya Davalos. Soon after, while Mary Jo was on the phone, a gentleman in a white truck drove up. Lupita and Mary Jo both spoke to him. We decided to continue with the training. As we were setting up, the gentleman in the white truck showed up again with another gentleman. Mary Jo approached both men and Lupita followed. I stayed behind and heard the older gentleman explain to Mary Jo what had been sprayed. He said it was nothing harming. It was a fungicide and calcium. I also heard him say he hoped they could clear up this matter between them and not contact the Department of Agriculture. They exchanged contact information and we continued with the training. As we finished loading once again, we saw another sprayer and heard the mist once again. Mary Jo shouted, "Quick, jump in the car." We got in the vehicle as fast as we could and left. All three of us saw a medical provider the next day where a L&I claim was filed. Within a day or two, I developed a skin reaction on my forehead. I felt tired and had stomach issues. this statement is the closest I could remember to the facts. So that was my statement, and all three of us wrote a statement. And even I told Mary Jo, even in rereading my statement all over again, it really took me back. And I do have to say, out of those 12 workers that were also sprayed, neither of them filed an L&I report. They were actually sitting in front of their housing, and they were the closest to the sprayer. And so if we felt the mist, I'm pretty sure they felt it as well, but none of them decided to report an L&I claim. I believe no one was seen by a medical provider. And so, but yeah, it really took me back to that day, and it really was, brought me back to thinking of those workers. Mary Jo, if there's anything you would like to add?
Yeah, I think as you were reading, Chris, I just remember, in my head, it's like, oh my gosh, we got sprayed on 3 times the same day by the same individuals in the same place. Yeah, I don't have any words for that, but let's move forward and
next slide.
Yeah, go ahead, Chris.
So we're just going to give you guys a quick background. We're actually going to play that short clip. It's not the greatest. It's a little muffled. I recorded it with my cell phone. And like I said, I wasn't quick enough to record, but just to give you guys a quick background, it was basically upon arriving to the housing site where we were going to do COVID education with a group of H2A workers. So basically, there was an air blast spray applicator being pulled by the tractor, and you'll hear that background noise. We had already been sprayed once, and then Mary Jo asked me to record. And so that's what you'll be hearing in this recording. And so you can kind of see the tractor, the second tractor in the video. You can do the next slide, Mary Jo. So like I said, it's very muffled, but you'll hear some of the conversations. We couldn't really distinguish the conversation in the very beginning. We can't really tell. But Lupe, you'll hear Lupita saying, oh yeah, I did feel that. Mary Jo saying, yeah. And I don't know what I was saying, but you'll see me hearing, I don't know if that, I don't know. I can't remember what we were talking about at the time. But Lupe did ask me if I could feel that, and I did. I think I'm saying yes at the end. Yeah, and so the tractor, again, the sprayer, it stopped and it turned it off again. But something I just want to say is that they should have known the workers were home, because typically their transportation isn't parked in the front, and the buses were parked that day. So they were home. And so normally they're like, if we're not home, those buses aren't here. If we're home, those buses are here. And the buses were there. I mean, they were clearly, they saw them, they were sitting in front of their housing site. So I really do believe this could have been prevented. But Mary Jo, if you want to play the clip.
I don't know if that. You feel that? Yeah. I don't know if that. You feel that? Yeah.
And I'll play it one more time.
I don't know if that.
So it's not the greatest video. Oh, where'd it go? So I believe Joanne was gonna jump in at this point, but like I said, it's not the greatest video, but that's just the second tractor. We all felt it, we all heard it, and we all smelt it. I know Mary Jo, she was the one that it caught her attention right away, and she even saw that she can see it was like a yellow mist. Correct me if I'm wrong, Mary Jo. But like I said, yes, we all felt it, we all smelt it, we all saw it.
We'll jump in just to say thank you so much, Priscilla, for that. Your words and sharing your experiences here. And I'll, again, just to echo what you had said, the three of you were exposed. You had symptoms. You were able to seek healthcare. Those three reports did come to the attention of the Department of Health and the Department of Agriculture because of your efforts there. There were 12 other people that were also exposed, and apparently no health care because we didn't get, at least under the workers' comp claim system, because we didn't get an automated report from Department of Labor and Industries workers' comp on that. And so there, we know that we undercount what we do find. But I do want to go back to Mary Jo, since Mary Jo, I think you were going to facilitate this discussion among the group.
Right. So I think at this point, what we had initially thought that we would break out into rooms. I think towards the end of this week, we felt like we might have a smaller group and that we could just have opened up our mics and have a discussion. But I was just trying to see how many people were on, and if Zach could help us maybe break up into groups if that was possible, and maybe put maybe Joanne, Priscilla, and myself in each of the groups, and then we can have a discussion and see if we can address these three questions that we have for you. Again, what was the role of clinics, promotoras, and other state agencies? And then what should we do? What laws and policies should we be addressing? And then what can we do about this as a collective group and have a collective vision, and maybe share it with some of our advocates who actually had a call this morning or a talk. And then if we do have time, we did share with you guys the procedure that we used at Moses Lake Community Health Center that I'll share in a little bit again if we have time. So at this point, we'll go ahead and break out into those rooms and maybe start addressing these three questions if Zach can help us. Are we all back?
I think so.
Not enough time, huh? Yeah, I don't think we had enough time either. We had some really good questions though in our group.
Yeah, I got a couple comments, and I think I may have a person who might like to share some thoughts on action strategies. May or may not putting anyone out there though that's not comfortable doing that.
Do they want to go first, Joanne?
I'm not sure where we're at and if everyone is actually back, because I can't see how many people are present. Oh, Dominica, I see you. And now I'm starting to see a few others.
So I'm wondering if Gina would like to report back, or Karina would like to report back from our group.
I think it may be hard for folks to unmute, and
I would be happy to share with some of the stuff that we found in our group. I'm Nectar Odabashian. I work as a regional education coordinator with AT Still University, School of Osteopathic Medicine in Arizona, and NWRPCA. And I was with Priscilla Tovar and Lori Marquez and one other person, and I feel so bad, I just didn't catch their name. But I thought we had a really good discussion around these questions, so thank you so much for posing these to us. Regarding the question, what is the role of promotores in clinics, local, state, and other state agencies with regards to prevention? And we said that all of these, agencies and individuals play a role in policymaking, shaping legislation, enforcing and sharing out education, as well as community building. we also just added that connection. Sorry, my cat likes to join. We also just added connection as promotores with acquiring knowledge about resources, knowing and understanding policy so that we can educate farm workers. And on the next question, what more should happen? Or sorry, should I stop there or should I keep going with the other questions?
Sure.
With what more should happen for laws policies, of course, we would like to say no pesticides. In a perfect world, we'd like to see no pesticides. Maybe, if we can find healthy alternatives where, bodies aren't being at risk. I think that would obviously be the most optimal scenario. We really need equal protection for farm workers, as is in every other industry. We have a lot of limits on these protections, and we're kind of like, why is that? We think that there needs to be mitigation in trying to help with underreporting, since a lot of incidents probably go unreported. So I think we need some policies in place for that. So I'll give some time to other folks, but those were just the main things that we discussed. Thank you so much for providing the space.
Thank you. So can I do a time check? Maybe Zach can update me with how we are with time, because I'm terrible with where we're at as far as our schedule is.
So we've got 5 minutes left, Mary Jo.
Okay, super. So maybe we can have one group very quickly report out. I want to say from our group, I'll just say we very similar, and we also want no pesticides. That's like our group vision, no pesticides. Okay, maybe one other group can add very quickly, and then we can end the session.
I wasn't in your group, Mary Jo, but I just wanted to add and kind of build off what Nectar said, that your comment, which is that if you hadn't been there, the incident might not have been reported, and that there are probably countless similar episodes that don't go reported. So a role for Promotorxs and for all of us as we increase our consciousness of these things that are happening around us and are affecting the food we eat and the people who have a part in the food that we all eat. It's just a really interesting thing going forward.
Yeah. I'm gonna hand this back over to my co-presenter, Joanne, so she can close the session for us. You guys, thank you so much.
All right. I want to just offer extreme thanks to my colleagues in public health and co-presenters, Mary Jo and Priscilla with the Quincy Migrant and Community Health Center. It's really them that inspired me to try and, get a slot into this forum. And I think that they really, that the people that work at the community and migrant health centers have an extremely powerful voice in preventing, and helping the really well-intentioned and hardworking folks that are investigating problems as they occur, not only the Department of Health, but, Labor and Industries and Washington and the Departments of Agriculture. I think they have a powerful role and need to be heard from. And then I think we all came to the understanding just again, that we may have already had, but again, that this is an underreported issue. And even though states like Washington State sees it sort of staying the same every year, or maybe even increasing some years, we don't think for a minute that we hear about or are able to investigate all of them. And of course, it's people that are disenfranchised in the communities, like H-2A visa holders, who really experience the most risk. I learned about this morning a situation in North Carolina where H-2A workers were sent home at their own expense after reporting pesticide-related concerns. So it's not all bad. We can change this, but we really need each other. Reporting is important. The systems are imperfect, but they are there to protect workers and communities of all types. So again, extreme thanks to Mary Jo, Ybarra-Vega especially for, really, working with her team, the health promoters at Quincy, and inspiring me to go ahead and apply for this, and for the forum organizers and for everybody that took the time to participate in this session. Thank you very much. Mary Jo, any other words? Priscilla? Okay, then I'm signing off. Y'all get to your next session on time.